Being able to see is a gift, and for many, it's fleeting. Many rely on glasses or contacts, and as they age, cataracts can become an issue.
But now, corrective cataract surgery is more accurate than ever, and it's available to more patients. Michelle Dunaway and Chief Photojournalist Corey Adkins meet a patient whose vision was restored in today's MedWatch report.
It's a new experience to be able to look down the road and see signs, street signs, and be able to read the signs without wearing my glasses. Like the street sign here for Downriver Road, I would have been able to read that.
Gary Smith is celebrating his sight after cataract started clouding his vision.
I was at a point where I could hardly read the signs with my glasses. Now I can read them without my glasses.
Hi, Mr. Smith. How are we doing?
Good. He lives in Frederick and was a candidate for a cutting-edge surgery, brand new to Munson Healthcare Grayling.
Well, in terms of cataract surgery, I believe this is the latest and greatest.
Ophthalmologist Daniel St. Aubin says cataracts are very common, especially as we age.
Inside of our eye, we all have a natural lens, and that lens over time becomes cloudy for many reasons. UV light from the sun, aging, medications we take. Cataract surgery is when we remove that cloudy lens and implant a crystal clear lens in its place.
The new Aura gives the surgeon a better idea of just how strong those new lenses need to be.
Traditionally in cataract surgery, it is not uncommon to need a pair of glasses after our procedures. With the Aura technology, we're able to increase our accuracy of the lens that we place into the eye to become more independent of glasses after surgery.
Before this, doctors had to rely on a preoperative eye exam, which isn't always the most accurate.
With the Aura, we're able to take measurements of the eye as we're during surgery to help us determine which lens will be the best fit for a patient.
The technology is especially effective for patients who've had LASIK surgery, those who've had a very strong prescription, and some who may have a different eye shape. Gary was one of the first patients in line for the new Aura technology in Grayling, and he was admittedly nervous.
I'm a reader. I love to read. So anything that interferes with my eyes causes some sort of tension to build up. So I went into it knowing that probably everything was going to be fine, but I still had that. On the other hand, it could be a little worse. So going into the surgery, I went in anticipating the best, knowing that it could be less than that.
And in the end, he was glad he did.
If I'd have known what it was like, I would have had it done years ago if I could have. It was almost immediate. That same day I had vision that was much better than I had had in years. And by the next day, the vision had improved to a point that was better than anything I can remember in my life.
With Chief Photojournalist Corey Adkins, for MedWatch, I'm Michelle Dunaway.